All right, good afternoon, everybody, and welcome to the webinar. This is a True Solitude 1000 webinar. I'm streaming live on One Time Ministries Facebook page as well as the True Solitude 1000 YouTube channel. So, we're going to be talking about Breast Cancer Awareness Month, and the specific breast cancer awareness topic I'm talking about on this platform is about metastatic breast cancer. Many of you may know the story that my mom was diagnosed with metastatic breast cancer in 2016. Well, actually breast cancer, but we didn't find out it was metastatic breast cancer until like 2020. But that's what she passed away with last year, August. And that was the most devastating thing to ever see somebody that you love go through. And I'm here to advocate and educate people about this disease to give you a better understanding. Like I said, October 13th, 2021, I'll be sharing more insight. You'll see a lot of this information on my platform. I'll come back and give verbal details on this, but today I want to speak on it on this platform today to give you an understanding what this is. So the description I'm going to get you, the description I'm going to read to you all today is going to give you an understanding about what it is. Okay, metastatic breast cancer is a breast cancer that spreads to another part of the body, most commonly the liver, brain, bones, or lungs. Cancer cells can break away from the original tumor in the breast and travel to other parts of the body through the bloodstream or the lymph node system, which is a large network of lymph nodes and vessels that work to remove bacteria, viruses, and cellular waste products. Breast cancer can come back in any parts of the body months or years after the original diagnosis and treatment. Nearly 30% of women diagnosed with early stage of breast cancer will develop metastatic diseases. Okay? Some people have metastatic breast cancer when they are first diagnosed with breast cancer, called de novo metastatic. This means that the cancer is in the breast was not detected before it spread to another part of the body. A metastatic tumor is a different part of the body. It's made up of cells from breast cancer. So if breast cancer spread to the bone, the metastatic tumor in the bone is made up of breast cancer cells, not bone cells. Being diagnosed with metastatic breast cancer can be overwhelming. You may feel angry, scared, stressed, outraged, and depressed. Some people may question the treatment they had or maybe be mad or their doctors or themselves for not being able to beat the disease. Others may deal with the diagnosis of metastatic breast cancer in a matter-of-fact way. There's no right or wrong way to come to terms with the diagnosis. You need to do and feel what is best for you in your situation. Keep in mind that metastatic disease is not hopeless. Many people continue to live long, productive life with breast cancer in this stage. There are a wide variety of treatment options for metastatic breast cancer, and new medications are being tested every day. More and more people are living a life to the fullest while being treated for metastatic breast cancer. While metastatic breast cancer may not go away completely, treatments may control it for a number of years. If one treatment stops working, then usually another one you can try. The cancer can be active sometime and then go into remission at other times. Many different treatments alone, in combination or sequence, are often used. Taking breaks in treatments when the disease is under control and you are feeling good can make a big difference in quality of life. So as I read this, everybody, it tells you that it comes and goes. So with metastatic breast cancer, it really giving you an overall picture of some very key points, everybody. And we're going to get a little bit deeper into this. I'm going to share my next slide with you all. So this is talking about the symptoms. I know you may not be able to read this, so I'm going to go ahead and read that. You can't see it. You can't see it on this screen. I'm going to go ahead and read this part, but I'm going to read the symptoms of it. The symptoms of metastatic breast cancer can vary greatly depending on the location of the cancer. This section covers the symptoms of breast cancer that has spread to the bones, lung, brains, and liver, and the tests used to diagnose metastatic breast cancer. Bone metastatic symptoms and diagnosis. The most common symptoms of breast cancer that has spread to the bone is suddenly noticed new pain. Breast cancer can spread to a bone, but most often spread to the ribs, spine, pelvis, or the long bone in the arms and legs. Lung metastatic symptoms and diagnosis. When breast cancer moves into the lungs, it often doesn't cause symptoms. If a lung metastatic does not cause symptoms, they may include pain or discomfort in the lungs, shortness of breath, proceeding coughing, and others. Brain metastatic symptoms and diagnosis. Symptoms of breast cancer that can be spread to the brain can cause headaches, change in speech or vision, memory problems, and others. When Liver metastatic symptoms and diagnosis. When breast cancer spreads to the liver, it often does not cause symptoms. If a liver metastatic does not cause symptoms, they can include pain or discomfort in the midsection, fatigue and weakness, weight loss or poor appetite, fevering, and other symptoms. When I was reading the one about the lungs, hold on everybody. When I was reading the one about the brain metastatic symptom and diagnosis, I was thinking about what my mom was going through, and I was thinking about how she has dementia. But I'm not a doctor or a nurse or a physician, but I'm kind of thinking that did that have a lot of problem with her memory trouble with that going on in her body? And that goes back to think that dementia was one of them, but that could have been some of the part of that metastatic too. And that's just like, okay, really? And that just gave me, I just had an epiphany just then. Just like thinking about it and reading it at the same time. Like she had dementia, she had kidney disease, and then she had breast cancer that led to metastatic breast cancer. And she was having problems with her memory. And I wonder, did that play a part into a lot of that too? It just got me thinking, everybody. Okay? Alright. But that's just something to think about, like literally, like, wow. I'm just going back to thinking about all the stuff she was going through, and was that one of the symptoms too? Just never know. But that's something that I never really thought about until now. Okay, everybody. After a diagnosis of metastatic breast cancer, it's helpful to take all the time you need to gather information and make decisions about your treatment. Learn about the medical specialists that may be involved in your care, treatment options, generic testing, taking breaks for treatments, and more. First thing, surgery. Doctors sometimes recommend surgery for metastatic breast cancer in order, for example, to prevent broken bones or cancer cell blockage in the liver. Chemotherapy. Chemotherapy is used in the treatment of metastatic breast cancer to diagnose or destroy the cells as much as possible. Radiation treatment. Your doctor may suggest radiation therapy if you're having symptoms for reasons such as easing pain and controlling the cells in specific areas. Hormone therapy. Hormone therapy medications are used to help shrink or slow down the growth of the hormone recipient of positive metastatic breast cancer. Target therapy. Target therapies are target specific characters of cancer cells, such as protein that allow the cancer cell to grow in a rapid or abnormal way. Local treatment for distant area of metastatic. Local treatment are direct specifically to the new location of the breast cancer, such as the bone or liver. These treatments may be recommended, for example, the metastatic breast cancer is causing pain. Genetic testing or metastatic breast cancer videos. A licensed certified generic counselor discuss the benefits of generic counseling and generic testing for people with metastatic breast cancer, and women living with metastatic breast cancer share why they choose to undergo generic counseling. So there's different scenarios here: complementary and hospital medication and metastatic cancer. Practicing such as acupuncture, massages, hypnosis, medication, yoga help ease the symptoms of metastatic breast cancer, lessen treatment side effects, and improve quality of life. Clinical trials of metastatic breast cancer. Clinical trials to metastatic breast cancer are important steps in discovering new treatments, improving the standard of care. They can also help eligible patients receive new treatments. Taking a break from treatments for metastatic breast cancer. Many people with metastatic breast cancer decide at some point to take breaks from treatment, to stop treatment. This page, so basically what it's talking about is the different qualities of it. And I'm going to read this last one, so y'all pray for old Remarkable, okay? Metastatic breast cancer diagnosis can be a lot manageable, physical and emotional. Read about ways to live with metastatic breast cancer, including working after your diagnosis, facing fears, getting emotional support, and more. I did that, everybody. I'm proud of me. I did that because that thing was super small. I was probably like 2. Next time when I do another presentation, I don't have to make them extra big, but I was trying to fit it all in one presentation. But these are some of the things that you see. On this part, on the left side, you see the different symptoms of metastatic breast cancer. And on this side, you see the different treatment options: surgery, chemotherapy, radiation, hormone therapy, target therapy, local treatment from distant areas of metastatic, generic testing, and metastatic breast cancer videos, complementary hospital medical and metastatic breast cancer clinical trials, and metastatic breast cancer, taking a break from treatment for metastatic breast cancer, and living with metastatic breast cancer. So these are things on this side that kind of give you an understanding of what this really looks like. For my mom, she went through the surgery. She went through the radiation treatment. She didn't do the whole IV and arm. She had the chemo Iran that she took for a very long time. And then ended up switching it because they said the capsules wasn't dissolving, so they ended up giving her the pill form. And that's when everything in her life started to really slowly deteriorate, like within months. And that's when we found out that the cancer did come back. And it was metastatic breast cancer, of course, where it spread to other parts of the body. And like I told you in the video who I've shared on my platform, that they thought the cancer was gone, the blood work didn't show anything, nothing, but nobody really did the whole gynecologist thing to find out what was going on in the bottom parts. And nobody ever knew before it was too late, and it was already too late. And that's two things you should think about, ladies. Breast examination is very important. Also, to make sure you get your pap smears to test and see if anything's going on down there. And just taking care of you is very important, ladies. It's very important. It's very important to look after your body. If something in your body doesn't feel right, I recommend you get that checked out immediately. There's resources, there's organizations out there that can help you. And I have a link that I want to share, or actually an organization I want to share to this platform. I was actually on a Zoom call last night regarding that can help you with mammograms and all these different things. Get in contact with them and see what they can do for you. Okay? Alright. The images of metastatic breast cancer. So what I'm going to do is going to show the video. I'm going to stop sharing my presentation and then I'm going to go to the link, but I'm going to show you the video first, everybody.
Understanding metastatic breast cancer. When breast cancer spreads to other parts of the body, such as the bones, liver, lungs, or brain, it is called metastatic breast cancer. It is also called advanced, secondary, or stage 4 breast cancer. Metastatic breast cancer is a life-threatening disease that cannot be cured. About 4 in 10 people with metastatic breast cancer are alive 5 years after diagnosis, compared to 9 in 10 with stage 1 to 3 breast cancer. Some people have metastatic breast cancer when they are first diagnosed with breast cancer. About 30% of women who previously had treatment for early-stage breast cancer will develop metastatic breast cancer. Symptoms of metastatic breast cancer may include tiredness and a poor appetite. You might have specific symptoms depending on where the cancer spreads. Signs cancer might have spread to the lymph nodes are a lump under your arm or in your breast. Signs of spreading to the bones are pain or broken bones. Signs of spreading to the liver are abdominal pain or swelling and itchy or yellowish skin called jaundice. Signs of spreading to the lungs are shortness of breath and a cough that doesn't go away, with or without blood. Signs of spreading to the brain are headaches, weakness or numbness in the arms and legs, vision problems, and changes in personality or behavior. Anyone can have these types of symptoms for other reasons. If you have them for more than a few weeks, or you or your primary doctor feel worried, contact your oncologist for advice. Treatment for metastatic breast cancer can help reduce symptoms, make you feel better, and sometimes help you live longer. However, it will not cure the cancer. Treatment depends on the tumor type, size, and where it is located, the treatments you already received, your general health, if you are in menopause and what stage, and if the cancer is growing slowly or quickly. To decide about treatment, you need to understand the potential benefits, its side effects, and how it might affect your life in general. Doctors call this your quality of life. The main treatment for metastatic breast cancer is called systemic therapy. This is treatment that affects your whole body, such as hormone therapy, chemotherapy, or targeted therapy. Local therapy is treatment for specific areas of your body with surgery or radiation. You might have both local and systemic therapy. Hormone therapies are given if your tumor responds to the hormones estrogen and progesterone. Tumors that respond are often called estrogen or progesterone receptor positive. These hormones allow the cancer to grow, but hormone therapies block their growth. They can help shrink or slow the spread of metastatic breast cancers. Hormone therapy is also given with earlier stage breast cancer to lower the risk of cancer coming back. If you have metastatic breast cancer, you can take hormone therapy as long as you need to control the growth of the cancer. Your doctor might suggest chemotherapy if your cancer is not estrogen or progesterone positive. The goal is to relieve symptoms, control the cancer, and give you a better quality of life. Once your cancer has spread, you might need chemotherapy for a long duration, but you might also change chemotherapy medicines or stop chemotherapy depending on how it's working or how well you tolerate the side effects. Chemotherapy can be given as an IV or a pill. You might take one drug or a combination. Side effects depend on the drug, but there are medicines to help with side effects. Some types of chemotherapy used for metastatic breast cancer include taxanes, anthracyclines, platinum agents, plant alkaloids, and capecitabine. Targeted therapies are drugs that control cancer by changing the way cells work. For example, you might have targeted therapy for HER2-positive breast cancer, an aggressive type of cancer. The therapy targets a protein called HER2 that makes the cancer grow. Targeted therapy can be given as a pill or an IV drip in your arm. Radiation therapy can shrink breast cancer tumors, relieve symptoms, and help you feel more comfortable. You might have it if cancer spreads to the skin, the lymph nodes, parts of the brain, or the bones. If cancer spreads to several places in the bones, you might get an injection of radiation to kill cancer cells and control pain. Breast cancer that spreads to the bones can weaken them. You may break a bone or have persistent bone pain. Two types of drugs are used to keep bones from getting thinner or breaking down from metastatic breast cancer. These drug types are called bisphosphonates and osteoclast inhibitors. If you have metastatic breast cancer, you will likely need to remain on treatment unless you choose to stop it. If one treatment stops working, you can change medications, try a different type of treatment, or join a clinical trial. Clinical trials may give you access to new treatments that are not yet available to the public. The goal of treatment is to control metastatic breast cancer for a number of years. Today, many people live well with metastatic breast cancer while getting ongoing treatment for the cancer and any side effects. Researchers are discovering more information through clinical trials, and treatments for metastatic breast cancer are becoming more effective.
Alright everybody, I'm going to stop sharing my stream. I'm going to show you another website. Before I end this webinar today, everybody, so I'm going to share my screen real quick. Give me a few minutes. Alright, so this is the website I want to share with you all. Alright, so this is what it looks like, everybody. So as you can see, we explain in details what it is. So I just wanted to show you this link to give you a better understanding. So see what that is. That's what it looks like right there. And it talks about in details about how does cancer spread and multi-size, and it gives you in detail about how that looks. It said cancer cells invade nearby healthy cell, cancer cell penetrate in circulation or lymph node systems, migrate through cell layers, cancer cells lock and calipers and new small tumor growth. Okay. So these are this is what that looks like. So they give you a diagram of it. It shows the brain, it shows the bones, it shows the lungs, and it shows the liver. Okay. And it says the metastatic in the bones may cause severe progressive pain, swelling, bones that are easily fractured or broken. Okay, and metastatic to the brain may precede progress worsening headaches or pressure to the head, visual disruption, seizures, vomiting or nauseation, behavior changes or personality changes. In the liver, it talks about jaundice, itching skin rash, abnormal high Izon in the liver, abdominal pain, loss of appetite, nausea, and vomiting. Chronic coughing or inability to get a full breath, abnormal chest x-rays, chest pain. Other non-systematic symptoms of metastatic breast cancer can include fatigue, weight loss, poor appetite, but it is important to remember these can be also by medication, caused by medication or depression. Okay, so these are some of the things I wanted to share with you all on that. So you can see on this, it shows you a diagram of it, and down here it gives you a kind of an understanding and kind of notes of the things to watch out for. Then it shows you the different symptoms right here on the right, and then it goes in detail about what caused each symptoms. It talks about bones, then it talks about the brain, and it also talks about the liver function as well as the lungs. Okay, all right, I'm going to go ahead and show one more slide for you all today, and I am off the clock. Okay, so this is the remainder of the presentation, so here we go.
Anybody with metastatic cancer will tell you that the first few months up to the first year is very difficult because you just don't have the hope.
I live from scan to scan, and it's not a good way to live. Sometimes I have a lot of headache, my body hurts, migraines, hot flashes, then I'm cold, then I'm hot.
My body was changing in ways I was not understanding and had no control over. Chronic diarrhea that comes on like urgently. It's no planning, and you get these severe stomach cramps. Lost my hair, I gained a lot of weight, I got a rash on my face, it looked like acne. I hadn't had this kind of acne since I was 12.
Once it became metastasized to the liver and it was discovered that the anti-hormonals weren't going to work anymore, we also discovered that I had damage to my femur. I wasn't able to put any weight on my leg whatsoever. It's a very painful surgery and a painful thing to go through. There's a titanium rod in the middle of it.
They called me and let me know, hey, your L5 broke. I was like, so how did it break? And he's like, well, that's the thing. So your cancer is back. It's in my spine all the way up. Like, it was in my sternum, it was in my collarbone, it was my lymph nodes in my neck. We're looking at 12 to 24 months.
The chin to waist back brace. And they were scared that it could just break at any moment and paralyze me.
And then fusions usually take up most of my day between getting blood drawn and seeing the doctor and waiting to get a seat. Those things are all part of my life that I'll never get it back, but I also understand it is my life. When I found out she was metastatic, well, of course I didn't want to hear that. And it was already hard enough knowing what she got diagnosed with. And I love my sister. I only have one sister, so I just wouldn't want her be without her, not having her in my life. I can't be taken away from my kids. Okay, it would be bad if I passed in a year. It would be sad if I passed in 5 years. It makes me just as sad if I'm not there to see my girls in their wedding dresses.
My son was petrified, just in place. I was petrified. I hung up the phone. I excused myself saying I had to go to the bathroom. I went into my room and I dropped to the floor because I didn't want to upset him because my kids are my life.
She showed up to my house and she surprised me because she had shaved her hair. She shaved her hair and she showed up. She said, "Happy Mother's Day to you." One day she told me, "You know what hurts me the most is my hair." She said, "Not so much that I have breast cancer, because at least, after the vasectomy I could just cover myself up and I feel normal. But without my hair, I don't." It's like you're walking and you're doing fine, and all of a sudden you're on a tightrope over the Grand Canyon. And
And some days I want to jump because my pain is so high.
When I woke up at night after these nightmares about having breast cancer, I still had it. It was a nightmare that just would not go away. It is a different type of cancer, and it's a cancer that's still killing people. And that's the hard thing to say, is that it's not curable.
I think it definitely takes a village to help someone get through breast cancer or live with it. Because it doesn't just end, it continues.
It's the hardest thing. That a person, I mean, I've been through so much, but it is so hard to live every single day. It's hard to do what I need to do to be a good mom, a wife. It's just hard to be alive.
We need people out there shouting it from the rooftop. We need more studies. We need more dollars for research.
All right, everybody. Thank you all for tuning in to the webinar for Breast Cancer Awareness Month. My name is Minister Johnson. I wanted to share my mom's story, and I'll be back on next week on the 13th to talk a little bit more about it. But I wanted to do this webinar in remembrance of my mom to make this awareness for everyone out there who have known someone or may have never heard of metastatic breast cancer, but you got an insight of what this looks like and how this happens and what are some of the symptoms and things to watch out for. Okay, everybody, I love you all. God bless you all. Ladies with Voices, I'll be on at 7 p.m. streaming live on YouTube, as well as the Ladies with Voices group page, and I'm going to share it on the On Time Ministry Facebook page, so that way you can get an exclusive footage of what's getting ready to happen on all these free places that have been, created for On Time Ministry. Have an amazing and a blessed afternoon, everybody. Take care of yourselves and the family, and I will see you all back here again at 7 p.m. sharp Eastern Standard Time.